My name is Elka. I'm an exercise physiologist. And does everyone know what an exercise physiologist is or does? Yeah, kind of. It's basically an exercise physiologist. We look at preventing, treating and managing chronic conditions and diseases. That's kind of a summary of what we do. And I've been an exercise physiologist for a little while now, but one of my first jobs that I had leaving uni was working in aged care. And it was a big eye-opener for me, just in terms of quality of care. I was lucky because the place that I was at was one of the top-end kind of aged care facilities. Basically, pool with a spa and fairy lights on the top that looked like stars. It was like one of the, not what you would kind of expect from an aged care home. But one of the things that I noticed as well with that came falls, and I guess the prognosis and outcome of having a fall, especially as you get older. Particularly working in an aged care home, they were, I guess, a little bit older as well, and so what I learnt was if someone had a fall, the life expectancy after that was very short. So having a fall is something that we really need to look at early on, because we want to make sure that we can prevent having a fall, and having a fall is preventable. It can happen, and it might happen, and probably will happen, but it is very much a preventable thing that we can address early on. Like my grandma, for example, she had a fall early in February, and as soon as I found that out, I knew that she didn't have much longer to live, and she passed away in October of that year. So, like, it's something that can happen, but it doesn't mean that if you have a fall, that's what's going to happen. Because if you start early and look at what the facts are now and address them early on, the prognosis after you have a fall is much better. Okay, so not to scare you, but it's something that can happen, particularly more so as we get older and going into aged care as well. So that's kind of who I am, and that's kind of like the experience that I have had in terms of aged care, and then looking at that falls prevention kind of side of things. So what I want to talk about with you today is what a fall is, what causes a fall, why we should be concerned about falls as we get older, and also there's the societal costs of having a fall, but also a personal cost that we need to kind of look at as well, because that's quite significant too. We're also going to talk about the concerns of falling, and there's a cycle with that can happen, and we want to make sure that we can address and stop that cycle, because it can be quite a downward spiral with that. And then we want to look at preventable risk factors and why prevention strategies are important as well. And then in terms of my side, the exercise component and how exercise can significantly impact the reduction in having a fall as well. So I don't want to talk too much today, but if you have questions, of course, you can just ask questions as we go. But I want to get you kind of moving a little bit as well. So I hope you're ready for that. But basically, like, what a fall is, the World Health Organization defines a fall as an event which results in a person coming to rest inadvertently on the ground or the floor or at a lower level. So obviously a fall doesn't just have to happen when you're standing, a fall can happen when you're sitting in a chair, obviously or lying down as well. So a fall then can happen at any kind of one of those levels, but you end up lower than what you initially started with as well. And there's a number of causes that can result in a fall. But essentially a fall occurs when a person's physiology can't cope with a task being undertaken or the environment in which a task is being undertaken. And they can happen both together as well. So if a person isn't capable of doing a task in a particular environment, such as wet weather, and it could be walking in wet weather and the change in surface levels, then that can result in a fall as well. So they're not, I guess, equipped or prepared for that environment or that particular task in that environment as well. So they can happen separately or they can happen together. So there's a number of causes that can lead to faxes being affected. And I've kind of grouped them just to kind of simplify it, make it a little bit easier as well. But for example, physical factors that can happen can be caused by disease, medication, aging, or inactivity. And 3 of those can be prevented as well. I know people are trying to prevent an aging process, but unfortunately it does happen still. But disease, medication, and inactivity are some causes that we can prevent, but they can have physical effects on us. So, for example, balance, strength, vision, sensation, so like our feet, so if we have an injury with our nerves or our leg, that can change about how we feel the ground when we're walking, and our stability, and also our reaction time, which is what can happen obviously as we get older. Our reaction time can decrease as well, and can then result in a fall. So those are some physical factors, and some of the particular areas such as disease, medication, aging, and inactivity that can affect the physical side of things. In terms of the behavioural side of things, of choosing what tasks you're doing, what activity, or the amount, I guess, of risk. So, while it's slippery, do you choose to run out and run to your car, because it's raining? So those kinds of choices can also affect whether you have a fall or not. So that comes down to cognition, mood, attitudes, and whether you're distracted. And nowadays, we can be very easily distracted, whether we're on our phone, if it's busy and there's lots of people around, or if there's a dog that runs past, or all these different kinds of things, we can easily be distracted, and then that can lead to a fall as well. So the last one is environmental hazards, footwear, and glasses as well. And as we get older, obviously most of us will wear glasses, and I'll talk a little bit more about that side of things as well. But they can be triggers to having a trip or a slip as well, particularly again in this perfect weather for us to discuss this. When we're outside, the environmental hazards, the different surfaces, so as it's wet now and walking in with wet shoes, this surface may be a bit more slippery. So making sure we have the appropriate footwear while we're out and about is important as well, and then obviously making sure with our glasses, prescriptions, and making sure it's single focal as well is also important. You're like, wait, what?
Just gone into bifocal.
Yeah, so one of the reasons that is because when it comes into bifocal, the bottom part of your glasses is a bit more blurred, which can kind of distort your perception and things like that. So that can cause a fall as well, depending on the environment and things like that. So that's one of the reasons why they say as we get older, just try to have different glasses, which is great to when you don't remember where your glasses are half the time or where things are half the time. So, but they say that trying to avoid the bifocal or multifocal glasses can help prevent having that blurriness at the bottom and having that fall as well. So those are kind of like the different areas. If I'm going too fast, let me know as well. I can slow down if you need to ask questions or more clarification. But the reason why we should be concerned about falls as well in older adults is the statistics are quite stark, are quite, I guess, convincing about why we need to be very on top of this as well, about trying to prevent having a fall. So basically 1 in 3 Australians 65 years and older will have at least one fall in a year. Okay, but those who are 85 years and older, 1 in 2 people will have a fall, at least in a year as well. And that's in Australia. So, so if you think about it, say we're about 65, okay, so that's half, 2 people in this group will have a fall at least once this year. So it's quite significant as well when you think about it. But to give you more to think about, this accounts for 1 person, 65 years or older, being hospitalised because of a fall every 3 minutes. So that's about 400 people a day, which is, it's crazy when you think about it, just in one day. So it's so important that it's great that you guys are here, because we want to start early so that we can not make you a statistic. Let's face it, we want to try and prevent you having a fall. And if you do have a fall, we want to make sure that you have the best prognosis after for getting better and continuing with your daily life as well. Not to scare you, by the way, sorry, but it's quite eye-opening when we think about it. And 50% of falls happen at home as well. So many of us may still have, we have family around and we live with family and things like that, and we have that support, which is great. But then as we get older, we may be living independently and by ourselves. And so if 50% of people have a fall at home, it's very, very important that we can make sure that when you do have a fall, the injury isn't significant or as significant, and you have things in place to get the help as soon as possible as well. I heard just the other day someone, I think people were complaining about, the services with the ambulance and things like that, and the amount of time it takes. And someone was saying that someone had a fall and they were there for a number of hours because they couldn't get up and they didn't have a phone nearby to call for help. And there are things that you can get, like you have the emergency many alerts and things like that. So there are things in place, but if we can just try and prevent having a fall, it's probably the best thing that we can try and do as well. But I guess in terms of that, the cycle costs of having a fall are now, I think it's over $2 billion a year. For costs of society and our healthcare as well. It's quite significant, and it's something that's preventable as well. Like many other conditions and diseases, they are preventable, and if we can try and prevent them, that's the best case that we can achieve, really. So statistics also show that the leading cause of hospitalisation due to falls is significantly higher than for chronic conditions as well. So if you think about all the different chronic conditions that we have, heart disease, diabetes, all those kinds of things, falling is much greater in terms of that as well, which is, it's kind of crazy, right? Like it's something so preventable, and compared to other chronic conditions and diseases, it far outweighs them. So as high as 77% for hospitalisation, and 71% of deaths caused due to injury as a result of fall. So quite large numbers. I'm trying to get all the scary stuff out of the way so we can get to the better stuff, but it's something that we need to just be educated about as well, and just be aware of, so that we can do something about it. What is also like significant to me as well is that 77 of those hospitalizations, majority of them were women, and out of the 71% of deaths caused due to injury as a result of fall, the higher death rates were in men as well. So it's just not again, not to scare you, but it's just numbers. It's the statistics that we have on just falls alone. So in terms of that, that's the societal costs, but there's also the personal costs to the individual as well. And I think the personal costs to the individual in terms of having a fall are probably quite significant as well, and this is where we can really try to make a difference and really try and address this as well. So loss of functional mobility. So being able to walk and things like that. Those who, like many of the people who are discharged after being hospitalised end up in a nursing home, and the risk of having a fall in a nursing home is quite high, is much higher as well. I think it's 3 times higher than out in the community as well. And working in aged care, the number of staff and the number, compared to the number of residents and patients is not enough. And the quality of aged care. I haven't worked there for a while, but when I was working there, quality of aged care, and I worked in 2 different kind of totally stark contrasting places, is quite shocking as well. So I can understand how falls increase in aged care in a nursing home, and it shouldn't happen. It just shouldn't happen. So those who do end up going back home though require ongoing care as well. On top of that, there is that social isolation when you have a fall, because there is that fear that we might have a fall again, and then we tend to isolate because we don't want it to happen. And then of course loss of confidence, and that's one of the big ones I saw working in aged care as well, that the loss of confidence of just being able to do little things, simple things, even walking as well. There is that fear and that loss of confidence, which is what when I see someone who's had a fall, it's something that is one of the main things that I try to build up again, because if you have that confidence, that independence comes back as well. When you have a fall, that loss of independence is so significant as well. I don't know, most of us may have had an injury of some sort or things like that. It's not just the physical side, it's also the mental side that plays such a massive role in how you get better. And it plays in, you get that frustration, but also when it comes to a fall as well, it's that fear that comes into play of, is it going to happen again? When is it going to happen again? And then it really kind of ends up into a spiral. And that's just what I want to come to in a moment. But it's important that we have a healthy concern of maybe potentially having a fall, because it helps us keep safe, right? We have that kind of sweet spot where with anything where we are a bit worried, a bit concerned about something, but we put in places and things that help us to keep safe. And sometimes what happens is when we have a fall, then we can go too far past that sweet spot where we put in some stuff that's safe, and we can end up just spiraling because we get too overwhelmed and too concerned about having another fall. And so I'll write it up on the board, so I get to use the board. But this cycle of concerns of having a fall can happen like this. So which colour should we use? Purple? Purple? So what happens is we have a concern, and hopefully you can read my writing. Concern of falling. Okay. And then what happens is when we have a fall, or we're concerned about having a fall, then that leads to avoidance. Right? Because we don't want to have a fall again. So there's the avoidance. And the avoidance can be of stuff that we enjoy, going shopping, meeting with friends, simple, or even just like simple things that we might do at home. So then we have a concern, and then because we're concerned about something, we avoid it because we want to keep ourselves safe. And then what happens is when we avoid, our strength and our balance decreases. Because we're avoiding all the stuff that we usually do that keep us strong, like walking and getting out and lifting and carrying things. When we start to avoid stuff, then our strength and balance starts to decrease again. Because we're avoiding the things that we're enjoying, we're avoiding the things that we should be doing. So then when that happens, when our strength and our balance decrease, then there's an increased risk of falling. That happens. And when there's an increased risk in falling, then our independence and our confidence decreases. Right? Can you see how the cycle works? So then our confidence goes down, and also our independence. If I can spell that right. Okay. I don't know about you, but most of us really enjoy our independence, right? We love being able to do things by ourselves and not have anyone else tell us what to do, right? So that's part of our independence. And as you can see, when that happens, then the concern of falling increases again. And then when we're more concerned about falling, then we avoid even more. And then when that happens, our strength and balance goes down. When that happens, the risk of falling increases even more. And then when that happens, our confidence and independence goes down again. And then we come into the vicious cycle of potentially having a fall. But if we can stop that, right, and we address our concerns, and then we're less avoidant because we are not as concerned, because we incorporate more strength and balance into our routine and have a program that we're working on, then our risk of falling decreases and our confidence and independence goes up. And we can break the cycle without breaking the pain. Okay? So we want to try and stop this cycle from happening. Once someone has a fall, there is that fear, the fear of falling again. And if we can break that fear through education, right, and through exercise, and putting in place things that prevent someone from having a fall, we can break this cycle. And that's one of the things we really want to make sure we do. So some of the preventable risk factors are, if we're taking medications, making sure we keep on top of that, making sure we go and tell our GP if we're, if our medication isn't helping us, or we're having too many side effects or things like that, making sure we go to the GP and have a chat to the GP about that and discussing those medications that we're taking. Vitamin D is also very important. Why is vitamin D important?
Calcium.
Calcium. So vitamin D helps calcium absorb. So yes, vitamin D helps calcium absorb, which obviously is very important for our bones. So the stronger our bones are, the better it is, obviously. And as we get older, we know that our bone density doesn't increase anymore. So I think it peaks about 20. Yeah, no, it peaks at 20. Like, so we usually try and get kids to like jump around and do all those kinds of things and make sure they have the calcium and make sure they get some sun so it gets the calcium gets up, there's the uptake of calcium into our bones and it gets used in the ways that we need it to. But it peaks around 20. So after that, the amount of bone density you have from that age, that's it, that's the peak. And then it kind of goes down or maintains from there. So it's super, super important that we try and, now we can't do that, right? We're all past that stage, but we want to make sure that we don't have significant loss. We want to try and maintain it as long as possible. And yes, it will eventually go down, but if we can try and delay how quickly that declines, that's super, super important. So getting that vitamin D is important to.
So if we've let it go down, now, do we take vitamins, etc. for it? It's not going to go up.
It's not going to go up.
We've lost it.
But we want to
So how do
maintain. We want to maintain. Yeah. So generally we should get it through our diet, but it's something as well to speak to the doctor and get those checks done and get those annual or biannual checks, blood tests done to see where it's at, and then put in place things that will help to maintain it as well. If you are absorbing calcium, then making sure you get the supplements for it. They do say that with vitamin D, not to have it like as a massive shot of vitamin D at once. It has to be like slowly over, ongoing, like 10 minutes a day kind of thing, but not like every month you get like a massive boost of it. And they've shown that it's not helpful in terms of that as well.
I was going to ask you, with the bone density testing, how often should that be done?
It depends. Oh, I couldn't actually say. I think maybe it's something to have a chat to your doctor about, because then they can get a referral for you, and it depends like where you're at and the level that you're at, and whether they it's something that needs to be addressed in terms of, do you know what I mean, where it's at. So I think it's something that maybe it's to speak to the doctor about, but I'm not sure exactly as to how often that you would need to get that checked. It's a good question for the doctor though, to have a chat to them about.
I'm actually looked in on Friday for that very question.
Oh, perfect.
Yeah.
Good.
I'll let him know.
Yes,
I'll let
and
you
then let me know.
Yeah,
Because that's something that would be very handy to know as well. So then it comes into that, diet. If you have osteoporosis or a history of low trauma fractures, it's something that you speak to your doctor about and manage as well. I think there's medications that you can take for it, but it's a conversation for the doctor as well. And there is a difference between osteopenia and osteoporosis. So osteopenia is kind of like the initial kind of before you get that osteoporosis where the bone density decreases. So if you can catch it in osteopenia, there is a chance that it may not quickly develop into osteoporosis, which is like that brittleness, I guess, of the bones as well. So there's a difference. Heart conditions as well, visual impairments, particularly from what I've seen, particularly if you have cataracts, they say if you can address that, it really helps to reduce the risk of having a fall as well. And we talked about the glasses as well previously. Any foot problems or disabling foot pain as well, it's really important to speak to the doctor, but then also see a podiatrist, which is probably the best person to speak to about any foot issues. And then, of course, a reduction in strength or balance is something that you can prevent as well. So grip strength is really, really important because that's that independence as well. There is correlation between grip strength and mortality rate and that independence as well. well. So if you can't open the jar or things like that, that has an effect. But overall grip strength and muscles, making sure they're nice and strong so that they can help you prevent having a fall too. So three areas that you want to look at is obviously staying active. So looking specifically at balance, strength and flexibility exercises, and keeping your home safe is very, very important because we know that 50% of falls happen in your home. So removing any hazards and adding any safety features, so railings, you can get railings installed, bars in the shower, if you can't stand for a long period of time or need breaks, then you can get shower chairs. All those kinds of aids are really, really important that you can also look at as well if you need to. And then obviously maintaining regular health checks with your GP. So your GP is probably your first point of call for assessing vision, your ears, because your ears have a lot to do with your balance as well, and any medications, any foot problems, they're probably the first people you'll probably go to, and then they will obviously then refer you out if they need to as well. So making sure you have those regular checkups is super important. So having an individualized home safety intervention can significantly reduce the risk of a fall in high-risk older adults as well. And if you get those interventions in place and occupational therapists are the person you go and see, and they will come and assess your home and make sure there's things, if there's trip hazards and things like that, or then if you need to get railings or bars installed, they're like the best person to assess for that. But it's been shown as well that it can help reduce falls after someone has an in-home fall by 38% in high-risk older adults. So getting an OT or occupational therapist out to assess and make sure that your home is safe from hazards, as many hazards as possible. For those who are at high risk of having a fall after they've had a fall, that risk of having a fall can decrease by 38% when you have interventions in place and strategies in place to help. So, to my part, the exercise side, studies have indicated that exercise can have a significant effect on reducing falls in community setting. So we're in the community setting. They have shown that exercise is probably like one of the key interventions that can help with preventing to have a fall, and it reduces falls by an average of 24% when the right strategies and things are put in place and programs are put in place. So obviously exercise can help with balance, your walking speed as well, obviously your muscular strength, body awareness is very important as well, and then obviously mental health and cognitive ability, like what we talked about before. Those areas all have an impact and factor into how well someone can manage a task or a particular environment and doing a task in a particular environment as well. So to have the greatest effect in preventing falls, we need to ensure, in terms of the exercise side, that we start getting exercises put in place to prevent a fall. They say that all older adults need to undertake exercises to prevent having a fall. Pretty simple. Exercises help prevent falls, but the exercises performed must specifically target balance and mobility, and then include strength training. So strength training, note, they have shown that it doesn't have as much of an impact in terms of preventing a fall. Yes, it can help with strength and things like that, and the stability side of things, in terms of being able to hold yourself up. But the key thing there is that must target balance specific stuff and mobility stuff. So strength alone isn't enough, you have to have the balance side of things as well. And they have to be challenging. So in terms of the balance stuff, for some of us, standing up on 2 feet isn't that challenging. But if I gave you a ball to catch
and I told you to count back from 100 by 7, it might make it a little bit harder because there's more concentration and there's a ball flying around and you've got to catch it and you have to move your body around. But then on top of that, if I then get you to put your feet together and then close your eyes, that's going to be a little bit more challenging for some as well. So it has to be challenging as well. In order to see improvements, we have to kind of get out of our comfort zone a little bit to make sure that we are growing, and also making sure that when we're out and about, we're not always in our comfort zone. We're not, the floor isn't like perfectly smooth and it just adapts as we walk, and it's never slippery and anything like that. So in order for us to grow and adapt and develop, we need to make sure we have things that challenge us. So that's probably that's also really important. And then exercises have to be done 2 to 3 hours a week. You're like, 2 to 3 hours is a lot. But if you break it down over 5 days, it's half an hour a day. And if you break that down, you can do it 10 minutes 3 times a day. So when we think about it, it's not actually a lot when we break it down enough. When we break it down enough. So it's 150, which is generally how much movement and exercise we need to do in a week anyway. But for this particular falls prevention stuff, we need to make sure it's particular in terms of the balance and the strength kind of side of it. So, and it has to be performed at least for 6 months. But ideally, we want to make sure that it's an ongoing thing. So just going, yeah, I've done my exercise, I've done this for 6 months, I'm all good, for the next year. That's not how it works. It has to be an ongoing thing, So it could be, and you can change it. And the most important thing that I always tell with anyone is you want to fit it into your lifestyle. If you can fit your exercise and you move it into your lifestyle, that's the easiest way to incorporate it in, right? We schedule everything else in. We schedule meetings or lunches with friends and all those kinds of things, but we don't schedule exercise as such. And all you need is 10 minutes in the morning, 10 minutes around lunchtime or after lunch or before lunch, and 10 minutes in the evening to get your 30 minutes. So if you do that 5 days and you can have the weekend off, right? If you do that, that's going to really help you. And that's all it really takes. And just incorporate it into your daily life. If you have a program, do a few exercises in the morning, do a few exercises at lunch, and finish off your program at night. And of course, it has to be designed by a health professional, either an exercise physiologist or a physio, or someone that's specifically trained in being able to provide a quality program that will help in falls prevention. So if we can ensure all these things, if we can ensure that we're doing an exercise program that targets specifically balance and mobility and then incorporates that strength side of it, if we can make the balance exercises challenging, and if we do that for half an hour a day for ongoing, every single day, if you can, ongoing, it's going to give us the best outcome for preventing a fall happening. And so they're probably the most important things that we want to kind of remember, making sure we want to stay active, we want to stay independent, we want to keep doing all the things that we want to do. And so if we can just incorporate these little things and little changes, if we can stay active, if we need to have a look at our home and address some of the things that maybe the rug on the ground or that little floorboard that just pops up just slightly. If we can address kind of those little things, they're the ones that are going to be make the biggest impact and the biggest difference to us. And then of course, making sure that we go and speak to our doctor if we have concerns. Go and speak to our doctor about medications or concerns with your balance or concerns with your feet or your eyes. Or obviously you can just go straight to the people that can address them. But
having that chat with your doctor first is going to be super, super important. And they're probably the three main things that you can do, and the three main things that that are achievable to help prevent having a fall. Because having a fall it's common, but it's not inevitable. And if we can address the staying active, if we can address the safety interventions at home. Remember, where half of the percentage of falls happen, and if we can make sure we follow up and do those health checks, then we can effectively reduce our risk of having a fall. And that's essentially why we're here, because if we can do that, it gives us the best outcome for enjoying the rest of our life. Okay? Good? Okay, let's move a little bit. Let's get up and exercise. I'm going to show you some, I'll show you some of the exercises you probably already know. I'm going to keep it really, really simple, but then we'll have a little bit of fun, and I'm going to challenge you a little bit because that's what I do.